26. That is the number of states, including Washington, D.C., that has legalized marijuana in some form. Indiana is not on that list because we have not been able to come to a conclusion, and many of our marijuana bills have been vetoed in our state house. Due to these recent events revolving around marijuana legalization, opinions differ on marijuana legalization throughout our state. When considering the legalization of marijuana in our state, Indiana residents must consider the health changes associated with the drug, its medical use, and the possible effects that marijuana legalization could have on Indiana's residents. There are positive and negative health effects, and according to author Jay Allen, one positive is that marijuana is better than narcotic painkillers, as it is safer and less addictive than many substances labeled as these painkillers. It is commonly believed that cannabis can help us more than these painkillers without getting us hooked like prescription painkillers do. Dr. Donald Abrams, Chief of Hematology and Oncology at San Francisco General Hospital says, "A day doesn't go by where I don't see a cancer patient who has nausea, vomiting, and loss of appetite." Aside from being a great painkiller, marijuana can also help people with nausea and vomiting, and this is essential with cancer patients because people that have these chemical treatments such as chemotherapy, they can't help but get sick for themselves. And so people also with AIDS can have the same effect. And then people who have eating disorders or just can't get their daily intake of calories, they can turn to marijuana when they need a appetite boost. There are also negative effects, and one of those being the first time you smoke marijuana, your heart attack risk increases by 4.8%. This is because marijuana smoke is more toxic, and you can have devastating lung issues more quicker than people who smoke only cigarettes, and that is shown to be as quick as 20 years. Dr. Sanjay Gupta, a neurosurgeon and reporter, says there is now promising research into the use of marijuana that could impact tens of thousands of children and adults, including treatment for cancers, epilepsy, and Alzheimer's, only to name a few. Marijuana is a medicine that should be studied and treated like any other. Some people disagree with Dr. Sanjay Gupta, and they say that marijuana's benefits do not outweigh the health risks, because if you have a small cancer tumor and you're prescribed medical marijuana, what happens if it makes it grow? These are things that people need to consider, because if they don't really understand the negative effects of their problem or marijuana that it could have on their problems, then they could be getting themselves into more danger than they are helping. And also these are also things that our state house needs to consider, because they need to figure out if they're putting their people in more harm than they are helping them. They also need to consider things for themselves, as I said, their people and their state. With that being said, tax advantages could be a lot higher. We could have a pot tax, which could give us more money, and we could use that as the government deems fit. Obviously, as people, there are certain things that we are unhappy with in how our government deals with our money. So in our state, we could do something that helps us encourage the state to use this for something positive, such as education or any other thing that we don't we don't see eye to eye with our government in. This large amount of money saved, it could change the lives of many Hoosiers, and we need to think about that as a positive. It could end the war on drugs. People who feel the need to have marijuana, say, to cure their headaches, right now they might not have a prescription for it, so they'll need to go out and try to buy it illegally, and that could be a problem because that could lead to a lot of problems with violence. And so this could have safer street conditions for our people, especially in like downtown Indianapolis and cities. Regardless of these skills and things that could change, there could be younger children coming out of the woodworks if marijuana was legalized, by saying that they need marijuana for certain things when they really don't. And statistics show that past month use of pot by 12 to 17-year-olds has been higher in states that have legalized marijuana. And who are we to say that Indiana won't have the same pattern if other states and most other states that have legalized marijuana medically have shown that these younger children are beginning to use marijuana? Who are we to say that it's not going to have the same effect on us Hoosiers? In conclusion, whether it's the street conditions or the potential for lung damage, there's something that's stopping our state leaders from legalizing marijuana. And although there is no current advancement in Indiana legalization, There are strong arguments on both sides, so who knows with half of the country legalizing marijuana, what Indiana could potentially bring to the table.
What do you think is causing the state people to not legalize marijuana?
I think it's probably because there are such strong arguments on both sides that also our state house is probably divided. There are great medical uses, and there are also problems that could come with it.
You mentioned something about pot tax. What is that, and how might that affect people that do not use that?
From my understanding, there could be like a medical sort of tax that could be paid by insurance or like from a pharmacy, and it would go to our government and we could use it. But I can look more into it if you'd like me to. But that's just like the general understanding that I read from one article.
Would they also use a pot tax if they release it for recreational use? Do you think that they could have a pot tax for that too, a higher tax rate?
I'm sure that they could, but I didn't look into any recreational use. I just looked into medical.
Do you know why marijuana smoke is so much worse for your lungs and stuff like that?
I'm not sure.
Now I've seen on like TV shows and stuff that that you can like bake it into cookies or something. How does that affect your lungs? Because that's what the main topic was.
Well, I'm assuming that if somebody is using marijuana for medical use, they're not going to be eating it. However, I'm not really sure. I'm assuming it would still affect your body, just maybe not your lungs in general.
Even if they do legalize it medically, do you think there would still be the high abuse of like people not using it for medical reasons, or do you think it'll lessen? Because they'll find a way.
People will still use it for recreational use. However, the people that do use it for recreational use right now, because they feel that it helps their headaches or it helps whatever, they could easily get it prescribed by a doctor, and that would help lessen the numbers. But there's always going to be people using marijuana for recreational use.
So, along the lines of what John is saying, how do they, the states that have legalized it, how do they prescribe the marijuana? Like, is it in like a pill form or just like
I'm not sure.
clumps of marijuana?
It's a specific they smoke it.
Because like if you
I know all
think
the
about it, if you think
statistics.
about, like smoking it is worse, but if you ate it, and people do eat it, and how like then the smoke would
I mean, everything that I read about it, it was all about smoking. But I feel that maybe there's something like if you baked it and you ate it, it would change the properties or something, that it wouldn't give you the full effect of helping your illness.
Do you think if they legalize marijuana, it would raise or lower the use of other drugs?
I'm not sure, because you would have to compare marijuana to the use of all the other drugs, and it could raise some and lower others. There's really no in between with that.
All right, thank you.